Bismillah ar-Rahman ar-Rahim. We will start with a quote of the day, which is a hadith by Prophet Muhammad sallallahu alaihi wasallam. Do not waste water even if you were at a running stream. I am Dr. Taimia Ayub, and today I will be presenting the topic of water quality and standards under the kind supervision of Professor Dr. Saira Afzal, Dean, Institute of Public Health, Lahore. This is the learning outcome of today's lecture. We will start with the definitions, then understand physical, chemical, biological parameter, review WHO and international standards, analyze Pakistan's national standards, understand important frameworks, and at the end we will be doing multiple choice questions. So this is a basic diagram to understand the today's lecture. What about water quality and standards? What are the main sources of water, which include surface water, groundwater, and bottled water? What are the contaminants? For example, bacteria, viruses, chemicals, turbidity, radiological contaminant, etc. What are different health impacts of these water contaminants? Like different diseases including diarrhea, hepatitis, stunting, economic burden, and so on. And few guidelines and standards, which include WHO guidelines, Pakistani standards, and international standards of different regions or countries. So, water safety plan, surveillance, all of these are important measures to ensure that water quality remains drinkable and it is benefit to the people and not cause any further harm. So, water quality standards are legal, science based regulations defining acceptable levels of contaminants for specific water use, such as drinking, recreation, or aquatic life. These standards ensure safety by limiting microbiological, chemical, and physical parameters like turbidity, bacteria, arsenic, and pH through mandatory monitoring based on guidelines from organizations like World Health Organization. So, core components of water quality standards. Standards are generally defined in two ways: numeric standards, specific concentration of substances. For example, in cases of arsenic, we have specific concentration which are explained in numbers, in milligram per liter or parts per million, that must not be exceeded. Then we have narrative standards, like descriptive statements intended to protect a water body's health, such as water must be free from objectionable taste and odor. So there are two types of standards. One are numeric, having a particular number, and then the other the statement. Then we come to another important distinction or difference, which are the standards versus guidelines. Standards are actually legally enforceable, mandatory limits or actions. For example, in cases of pH, it can also be standard or it can also be guideline. Then, for example, fluoride should be, the upper limit should be 1 milligram per liter. So this is a standard. Then we have guidelines, which are advisory recommendation, which are optional, not legally binding. For example, pH from 6.5 to 8.5, fluoride less than 1.5 milligram per liter. So countries adapt guidelines to create enforceable national standards for their own countries in their own scenarios and keeping in mind the local context. Again, this is a figure to explain the concept of guidelines versus standards. Guidelines are recommended limits, standards are legally enforceable, and countries adapt WHO guidelines in their own scenarios and make convert them into standards. Okay, so there are different guidelines across the world for water quality and standards. Some of them include WHO guidelines for drinking water quality, and then Pakistan have its own drinking water standards, which includes Pakistan Standards and Quality Control Authority. We will be explaining them later on. Then we have Pakistan standards for drinking water quality, which are given again by Pakistan Standards and Quality Control Authority. Then we have other few very important standards, which include America's United States of America standards, which are EPA drinking water standards by Environmental Protection Agency in USA. Then similarly, we have Australian drinking water guidelines by National Health and Medical Research Council of NHMRC of Australia. And similarly, India also has its drinking water standards, which are given by Bureau of Indian Standards. So, few key aspects of water quality standards we will be explaining them later on also. So, let's start. Categories standards differ for drinking water, potable, and environmental water. For example, rivers for fishing, irrigation, or recreational use. Core parameters, key indicators include microbiological, physical, color, taste, odor, chemical, heavy metals, fluoride, and radiological characteristics. Then we have microbial focus. The highest risk to drinking water is fecal contamination, with standards emphasizing strict monitoring of bacteria like E. coli. And then we have regulatory frameworks. National and local governments set standards based on their water sources and environmental laws, such as Clean Water Act in the USA, often following WHO guidelines. We will be also explaining with examples of national and local government standards with particular focus on Pakistan and Punjab in the coming slides. Now we come to again a concept of monitoring and enforcement of these guidelines and standards. So compliance is by regular monitoring ensures water meets acceptable limits with swift action taken if contaminants exceed these, such as investigation or public notification. Treatment processes standards define required treatment processes ranging from simple filtration to advanced purification based on raw water quality. We covered these different treatment processes in yesterday's lecture, so this is also mentioning of that. So, what is the importance of water quality? It is essential for life and health. It prevents waterborne diseases, impacts nutrition and sanitation. It is one of the key SDG target, which is particularly SDG 6. And of course, all humans have a right to safe water. So, definition of water quality has its physical, chemical, and biological characteristics. It is suitable for intended use. Potable water is safe for human consumption. Potable water is that water which is safe for human consumption. Now we come to sources of drinking water. We have surface water, which includes rivers, canals. Then we have groundwater, which includes tube wells, rainwater, and bottled water. These are some of the important drinking sources in Pakistan. Then comes we come to type of water contamination, which includes microbial contamination by bacteria, viruses, and parasites. Then we have chemical contamination by, for example, arsenic, fluoride, and nitrate. Then physical, which includes turbidity, color, smell, etc., and radiological contamination. So this is a figure showing these types of contamination. What is the public health impact? As I explained earlier, there are many diseases which are waterborne specifically or water related diseases, which includes diarrhea, cholera, typhoid, hepatitis A and E. And again, it can also lead to, in the long run, stunting, malnutrition, and all these then affect the economic capacity of a country. So these are the key water quality parameters, and we will be covering each of these categories. These include physical, chemical, microbiological, and radiological. And in the figure, it is showing some of the very important key water quality parameters with their values. For example, pH level should always exist between 6.5 to 8.5. Turbidity should be less than 1. Total dissolved solid should be less than 500 milligram per liter. Hardness similarly should be less than 200 milligram per liter. Chlorine content should also be less than or equal to 4 zero point 0 milligram per liter. Nitrate should be less than 10 milligram per liter. Lead level should be less than 0.01 milligram per liter. And bacteria or coliforms should be 0 per 100 ml. These are the values from the World Health Organization standard. Again, we come to physical parameters. This is a particular parameter for the color, which should be less than 15 TCU. Turbidity should be less than 5 NTU. Typical taste and odor, it should be tasteless and odorless, and temperature should be optimum. Then we have chemical parameter as explained, 6.5 to 8.5 pH. Total dissolved solid should be less than 500 milligram per liter. Hardness should be less than 200 milligram per liter. Again, fluoride, nitrate, and arsenic also have their levels. Microbiological parameter E. coli 0 per 100 ml, total coliforms, and then which are the indicator organism for to determine if there has been any contamination between sewerage water or drinking water. Then we have radiological parameters with uranium less than 30 microgram per liter, radon less than 100 BQ per liter, gross alpha activity and gross beta activity should also be less than zero point 0.5 and 1 BQ per liter. So this is again a table showing the radiological parameters according to WHO. In this table, there are added reference values for uranium, radon, gross alpha activity, gross beta activity, radium 226, radium 228, tritium, and indicative dosage. Then we have WHO drinking water guidelines and how they were developed. They were developed by World Health Organization and they have become a global reference standard. And they are actual basis for national guidelines for many countries across the globe. So these is the timeline to tell about the WHO guidelines for drinking water quality. These are also known as GDWQ. Fourth edition has been given in 2011 with 2022 updates. They were first published in 1958. Major revision is done every 10 to 12 hours. Fourth edition 2011 is the primary reference document globally. In 2022, addendum addresses microplastics, climate change implications. They provides health-based targets, not legally binding limits, used as foundation for more than 150 countries for developing their own national standards based on tolerable daily intake and guideline values, covers microbiological, chemical, radiological, and aesthetic qualities, and they incorporate risk assessment and risk management frameworks. So these are the some of the publications by WHO given on the right side, which include GDWQ fourth edition, then addendum, then update in 2022, protecting surface drinking water sources, and so on. This is again the update and guidelines for drinking water quality, fourth edition, incorporating the first addendum. It was published in 2017 and it has some important updates from the original document of guidelines for drinking water quality. Some of the examples of WHO key limits have already been given, like pH level, fluoride level, nitrate level, and TDS level. Apart from WHO, there are also other international standards which include in United States their environmental protection agencies, and then in European Union drinking water directive, and then we have ISO standards which include lab quality ISO 17025. Now we come to Pakistan drinking water standards and how they are similar and different to WHO, and also what was the process and development of these standards. So, establishment of national standards for drinking water quality in Pakistan. In 2002, Pakistan Standards Institution compiled the preliminary standards for quality drinking water. In 2004, Pakistan Council for Research in Water Resources prepared a report related to water quality in Pakistan with recommendation for establishing water quality standards. Johari 2005 from WHO office proposed a framework of action for improving the quality of drinking water in Pakistan. In March 2005, Health Services Academy, the Ministry of Health, in collaboration with World Health Organization, organized and conducted a 4-day workshop in Islamabad to update the existing water quality standards. And based on that workshop, it was to seek the input of experts from all important federal, provincial, and private agencies. And the combination of through different lectures, discussion, intense work session, and utilization of reading literature in light of WHO and Ministry of Health quality standards for drinking water in Pakistan were finalized. This is again short summary showing the Pakistan national quality standards. and how they are being made by Pakistan Standards and Quality Control Authority. Regulatory frameworks for water quality in Pakistan. First of all, we have Pakistan Environmental Protection Act in 1997. Then we have National Environmental Quality Standards, and then we have PS 4992 2004, which is the Pakistan standard for drinking water quality, primary potable water standard based on WHO GDWQ. Then we have Pakistan Water Policy in 2018, which is the framework for integrated water resources management, recognizing water as a national security issue. And then we also have National Drinking Water Policy 2005, which is mandate to provide safe water to all by 2025 and defines roles of WASA, PHED, local governments, and so on. For Pakistan, we have national standards for drinking water quality, which were developed by Pakistan Environmental Protection Agency and Ministry of Health, as explained in the. So, some of the examples include pH level of 6.5 to 8.5, which is the global standard. Then TDS 500 milligram per liter, which is a bit stricter than WHO. Arsenic level of 10 milligram per liter, and fluoride level of 1.5 milligram per liter. And this again, we have bottled water quality standards, which are PS 4639 standard. It covers microbiological study, chemical limits, and labeling requirements. So this is a comparison table between Pakistan National Drinking Water Quality Standards and WHO guidelines. So as you can see, for in the first column we have the category, then we have parameter, then we have Pakistan's values, and at the end we have WHO guideline value. So for the bacterial E. coliform, it is the same for both levels. For physical color, we have similarly the same level. Taste and order should not be objectionable. Turbidity is less than 5 NTU. Total dissolved solids are less than 1000 milligram per liter. pH is also 6.5 to 8.5. Now, as you can see, essential inorganic components like aluminum, barium chloride, copper, manganese, and zinc. All of them are quite similar, apart from manganese, particularly, which should be less than or equal to zero point 0.5, and zinc, which should be 5 milligram per liter, less than 5 milligram. And in case of WHO, the zinc level is 3 milligram per liter. So this is slightly different. Okay, so here, there is an important difference between the two guidelines and standards, which is the quantity of arsenic. So, Pakistan National Quality Standards for drinking water says it should be less than or equal to 0.05, and for WHO, it is very stricter level of 0.01 milligram per liter. Similarly, for lead also, Pakistan has a higher upper limit of 0.05, less than or equal to, whereas WHO says it should be 0.01 below that. And then we have slight differences in cadmium, otherwise, and mercury level, nickel level, and so on. So the basic reason for this difference in arsenic and lead, which have also been highlighted because they are important, an important difference is because that Pakistan is present at a geographical location where already arsenic is lead are present at naturally the higher level in the waters. So this is because of that location, the geographical location, that Pakistan has permitted slightly higher level of arsenic and lead as compared to WHO because of its geographical location. Now we come to pesticides and organic component comparison. So it is nearly the same. WHO has not given exact quantities, whereas Pakistan national quality standards have given us exact quantities of phenolic compounds and polynucleated aromatic HC. Similarly, for alpha emitters, Pakistan has stricter level, and for beta emitters, it's the same. So this was a brief comparison. Now we will look at the differences. and why they are present. Arsenic and lead. Pakistan permits significantly higher concentration compared to WHO recommendation. This is major area of concern for long-term exposures in regions like Punjab and Sindh. Microbiological standards, both frameworks strictly mandate zero detection of fecal coliform. This remains the most frequent reason for water sources being declared unsafe in PCR, WR reports. Total hardness, while Pakistan sets a limit of less than 500 milligram per liter as calcium carbonate, the WHO does not provide a health based guideline considering it primarily an aesthetic or operational parameter. Then we come to provincial limits and standards. In Pakistan, the regulation of water quality is divided between national standards and provincial enforcement. Following the 18th Amendment, provinces like Punjab have adopted and refined these standards to address local industrial and agricultural challenges. So these are some of the Pakistan National Drinking Water Quality and Punjab Environmental Quality Standards generally defer to WHO guidelines for specific pesticides limit. However, monitoring often focuses on classes of pesticides widely used in the spaces. So these are some of the pesticides include organophosphates, carbamates, and so on. Provincial enforcement by Punjab Environmental Quality Standards. The Environmental Protection Department, Punjab, enforces seven categories of standard to protect water sources from industrial and municipal waste. Municipal and liquid industrial effluents. These standards regulate what can be discharged into inland waters, sewers, or the sea. So also they have limits for biological oxygen demand, limit of 80 milligram per liter, and for chemical oxygen demand, it is limit of 150 milligram per liter. Heavy metals also have strict limits on discharge of chrome, nickel, and copper to prevent downstream contamination of drinking water sources. Then we have enforcement mechanisms and rule. Wastewater monitoring squad. The EPA Punjab deploys specialized squads to monitor and stop illegal effluent discharge. Then we have Environmental Sample Rules 2001. It defines the legal protocol for how inspectors must collect, seal, and transport water samples to certified labs for it to be admissible in a environmental tribunal. Then certification of environmental laboratories only reports from EPA certified labs which must submit monthly analysis records are legally valid for compliance check. Self monitoring and reporting to industrial units are required to self-report their effluent data periodically to EPA. Public health checklist for potable water. Similarly, there is a public health checklist which are derived from Punjab Water Quality Regulation, which microbial presence zero detectable, E. coli 100 ml of water, sanitary survey, no sewage line within 10 to 15 feet of a drinking water pipe. Tank cleanliness. Household must inspect clean storage tanks every 3 years, while commercial building mall offices must do so annually. Residual chlorine must be between 0.2 to 0.5 milligram per liter at the consumer and to ensure ongoing disinfection. So, these are some of the key takeaways and recommendations from today's presentation, which include standards set the floor but not the ceiling. WHO different standards and European Union and American standards provide minimum threshold. Pakistan PS 4992 aligns with WHO, but enforcement remains weak. Risk based approaches are essential. WSPs and sanitary surveys outperform simple compliance testing, adopt risk management framework in all water utilities. Microbial quality is the priority. Zero E. coli per 100 ml is non-negotiable. Residual chlorine at zero point 0.2 or more than zero point 0.2 milligram per liter must be ensured at delivery point throughout Pakistan. Arsenic and fluoride demand urgent action. Pakistan has high groundwater arsenic in Punjab and Sindh. Population screening plus alternative sourcing are public health imperative. Intersectoral action required. Water quality governance include health, environmental, local government, FASA, and communities. No single sector can succeed alone. Now we come to multiple choice question portion. A rural water supply scheme reports stability of 8 NTU after treatment. According to WHO guidelines, what is the most appropriate interpretation? Acceptable under all conditions, acceptable if microbiological parameters are safe, unacceptable should ideally be less than 1 NTU, only unacceptable if more than 10 NTU, or acceptable for rural settings only. So the answer for this MCQ is that
D.
it's Charlie. It should be turbidity should be less than 1 NTU. So it's Charlie for this. In Pakistan, the national drinking water standards are primarily regulated by Pakistan Environmental Protection Agencies, Ministry of Climate Change, Pakistan, Pakistan Council of Research in Water Sources, World Health Organization, or UNICEF.
C.
C. Yes, it is A. A community in Sindh shows high prevalence. Sorry, sorry. A community in Sindh shows high prevalence of dental fluorosis. Water testing reveals fluoride concentration of 2.5 milligram per liter. What is the best public health interpretation? Water within safe limits, slightly elevated but not harmful, above permissible limits causing fluorosis risk, only harmful in children under 5, or no intervention required.
C. C.
Yes, it is C. It is above permissible level of 1.5. Which parameter is considered the most reliable indicator of fetal contamination in drinking water? Total dissolved solids, pH level, nitrate level, Escherichia coli, or hardness of water?
D.
Yes, it is
D. D.
D. Yes. A sample, a water sample from Lahore shows residual chlorine at 0 milligram per liter and E. coli also present. What is the most appropriate immediate public health action? No action required. Increase filtration only. Initiate chlorination and issue boil water advisory, or add fluoride, or reduce turbidity.
C.
C. C.
Yes,
C.
it is. It is C. Yes. According to Pakistan standards, the permissible limits of arsenic in drinking water is 0.1 milligram per liter, 0.05 milligram per liter, 0.01 milligram per liter, 0.5 milligram per liter, or 1 milligram per liter.
B.
B.
It is B. Pakistan has higher permissible limit, which is 0.05. So it is B. A peri-urban water supply goes under a water supply uses groundwater with nitrate level of 60 milligram per liter. What is primarily health concern? Dental fluorosis, methemoglobinemia in infants, kidney stones, skin cancer, or neurological toxicity.
B.
B. C.
According to my, yes, it is C according to my answer key with higher level of. So this is the MCQ key. This is the YouTube channel where this video will be uploaded. And thank you very much for listening.
Thank you very much, Dr.